Hey guys, this is Dr. Moore with Cumberland Chiropractic and Sports Medicine. Today I'm going to be talking to you about elbow pain, or lateral epicondylitis to be specific. I'm also going to talk a little bit about our motto here. We say we get you better faster. I'm going to tell you a little bit about what that means, so stick around. Okay, so here at Cumberland Chiropractic and Sports Medicine, we say we get you better faster, but what exactly do we mean when we say that? Well, typically when a patient comes into our office, unless it's a really weird case that's going to be really complex and take some time, we say give us about 2 weeks of your time, about 6 consistent treatments to make a significant difference in your pain. And for people who have suffered with chronic pain or have undergone some more lengthy treatment methods, they'll tell you that 2 weeks time is a really quick turnaround. That's insane in the therapy world. And we're able to do that because we're really picky about finding out what your problem is and then the treatment for that problem. We make sure it's the best possible treatment to get you those results that you need quickly. So in today's case, we're talking about elbow pain or lateral epicondylitis. If you look lateral epicondylitis up on Google or on WebMD, you'll see that it typically takes between 6 months and up to a year's time to heal with traditional treatment methods, the rest, ice, and some medication. And that's a really long time. I can't imagine babying an elbow for up to a year. And it especially wasn't an option for a patient who came in with his elbow pain. He'd had it for about 2 months. He had recently been to see his primary care doctor. He told him he had lateral epicondylitis. He had a partial tear in one of the muscles in his forearm and that he needed to take some time off to kind of rest it and give it a chance to heal. But our patient worked in construction. He needed to be up, moving, swinging a hammer every day to provide for his family. He can't really be taking multiple weeks off of work in order to baby his arm. So he comes into our office. He tells me a story. I take a look at his forearm, find out where he's hurting, and tell him, give me 2 weeks, give me 6 consistent treatments. And during those 2 weeks, he was really good about being consistent. He was in here when he needed to be in here. He did the prescribed stretches, the exercises that we sent him home with. And at the end of those 2 weeks, he was able to tell me, my forearm feels great. I'm at work. I don't have to be icing it. I don't have to wear a brace. I'm back to working all day and not hurting, and it's incredible. He thought he was going to be dealing with this for up to a year because it says it can take that long, and he's hurting it every time he goes into work. But we were able to give him those results, and we were thrilled for him. That's the kind of stuff that we live for here in our office. So one more thing I will say about this case is that it was imperative that we were able to provide some laser therapy to this patient while I was treating him here in our office. In our office, we have a class 4 therapeutic laser, and it is kind of the reason that we're able to take these cases that can take months to heal and kind of shorten that time frame down into a few weeks. It allows the tissue to heal more effectively and quickly, and it encourages blood flow to that injured tissue, and it's really huge when it comes to muscle and tendon injuries such as that elbow case we just talked about. And lastly, guys, as a disclaimer, this is not me trying to set up unrealistic expectations to those watching this video. I'm not going to tell you that we get 100% of the pain that walks into our office better in 2 weeks time or less. There are some cases that are more complex. They require more time. Some require a referral or maybe some additional testing that we can send out for. But everyone that walks into our office does receive our very best care, and the majority of them truly do get better faster. So if you like this video, please give it a like. If you know somebody who could use to see it, please share it with them or post it onto your timeline. And if you have any questions or comments regarding what we've said in this video, please leave them with the video. We'd love to talk to you about it. So this has been Dr. Moore with Cumberland Chiropractic and Sports Medicine, where we get you better faster.